And welcome back into ABC 7 at noon. Now, individuals should be aware of some major problems here in preventing diabetes, especially with health problems during the pandemic. To talk to us about it, we have Dr. Blake Busey with the Texas Tech Health Science Center. Doctor, thanks for coming in.
Thank you for having me.
No problem. And let's get started right away, especially well, let's start, I guess, with the prevention of diabetes. What do people need to know?
So there's a couple types of diabetes, number one. So there's the type 1 diabetics that basically they can't help themselves. So those are diabetic mellitus, meaning sugar diabetes, or the sugars as it's phrased. Those people, they do not produce insulin. So as a result, they require insulin. The ones that are more problematic are the people that acquire diabetes. And those are usually type 2 diabetics. And we can splice them into people that are late onset, early onset, but what we've been seeing in the healthcare field is that this is happening earlier and earlier in life, which is unfortunate. The things that help prevent diabetes, of course, is avoiding extra adiposity, so adiposity being fat, and then increasing activity. So sugar content in all of our foods has been increasing. It's addicting. It's so tasty to have sugar. But as a result, it allows us to gorge and we gain weight and we have more volume of distribution for that insulin to work, and we become used to it. So our body stops responding and suddenly you have diabetes. You can't control your sugars.
Wow. Okay. So then I guess so people need to not only manage what they're doing, what they're eating, but then once you actually have diabetes, what do people need to know if they're trying to just better themselves?
Sure. So one of the things that worries me the most is that our culture, in particular in El Paso, it's different than anywhere else I've been, is that I'm fine until I'm not fine. So people may be walking around with diabetes for years by the time they actually come to the doctor. And by that time, they already have problems. They already have kidney failure. They already are starting to have, loss of nerve function in their feet. They're so poorly controlled that, it takes insulin injections, and people don't want to get to that point. To prevent that, early intervention is key. So seeing your primary care provider, or at least somebody that's willing to check your A1C, check your glucose, help coach you along the path to wellness. Make sure that you're not getting, too overweight, making sure that you're staying active, being your coach or, your cheerleader to help.
Gotcha. Dr. Busey, is there anything else you wanted to add?
So for me in particular, diabetes is one of those things I fear for myself because I've seen the aftermath of it. So it definitely is a motivator for me to exercise every day, try to eat reasonable foods, and basically decrease my carbohydrate intake. So one of the things I would encourage everybody to do is if you're eating from a box, try to eat from something that's packaged in, life. So actual fruits, actual vegetables, things that we're living and are recently living. That way you're actually getting a good nutrient as opposed to something that's been excessively processed.
Gotcha. Dr. Busey, thank you so much.
No problem. You have a great day.
You too. All right, we'll stick around here. We do have a little bit more news coming back from the break.